I want the vaccine in my life. I want the vaccine for my wife. I want to vaccinate you all day long. Vaccinate you while I wear my thong.
CDC Director Rochelle Wolensky admits that at least 75% of the people dying with COVID have at least 4 comorbidities. But what is fully vaccinated anymore? Hey guys, my name is Wesley, and this is not a podcast. Conservatives and Republicans have been sharing a video about the CDC director without context. But before we get into that, the Supreme Court blocks Biden vaccine or test mandate for large private companies. The U.S. Supreme Court struck down the Biden administration's vaccine or test rule Thursday, declaring that OSHA had exceeded its authority. So that's good news. But the CDC director, Rochelle Wolensky, makes a shocking admittal.
In that, is it time to start rethinking how we're living with this virus, that it's potentially here to stay?
You know, really important study, if I may just summarize it, a study of 1.2 million people who were vaccinated between December and October, and demonstrated that severe disease occurred in about 0.015% of the people who were received their primary series, and death in 0.003% of those people. The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with.
Now, I know many conservatives and Republican pundits shared only a part of the video without the context that the people that died were fully vaccinated, and her point was to say that the vaccines are working. But what does fully vaccinated mean anymore? It used to mean that you get the 1 J&J shot or the 2-shot Moderna or Pfizer series. Then the goalpost moved to a booster shot, and then it moved to a 4th booster. Well, now the Netherlands announces plan to give people up to 6 doses of COVID vaccine. But do you remember in August of 2020 when the CDC updated its website to say that approximately 6% of COVID deaths were from COVID alone? Now, people assumed falsely that the other 94% didn't die from COVID, but it is true that the other 94% of people that died also had at least 2 or more comorbidities. This is Reuters, September 3rd, 2020, before Delta and Omicron variants. The NCHS statement broke down the death certificates mentioning COVID-19. For 94% of people who had COVID-19 also had other conditions listed. COVID-19 alone was cause of death for 6%. Okay, let's add that with what Dr. Fauci recently said at the beginning of January of 2022, that children being hospitalized from COVID was actually an inflated number as well.
Is that if you look at the children who are hospitalized, many of them are hospitalized with COVID as opposed to because of COVID. And what we mean by that, if a child goes in the hospital, they automatically get tested for COVID, and they get counted as a COVID hospitalized individual, when in fact they may go in for a broken leg or appendicitis or something like that. So it's overcounting the number of children who are, quote, hospitalized with COVID as opposed to because.
Now let's add that to the 40% inflated hospitalization numbers.
But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got in a car accident. They're there because, they bumped their head. And they're being included as in the hospital with COVID. That number seems kind of misleading.
Yeah, I agree, Jake. It surprises me that they have not been able to parse out that data more carefully.
Carry the one and then divide by Joy Reid and others on CNN saying that Joe Rogan taking Ivermectin was him taking horse dewormer.
So things are clearly bad, but they're being made even worse by people who have refused to take the vaccine and instead are swallowing horse paste.
Ivermectin is something more often used to deworm horses.
Telling his 13 million Instagram followers that he was treated with several drugs, and he included Ivermectin on the list, a drug used for livestock.
Rogan said the word ivermectin. Yes, that's the deworming medicine made to kill parasites in farm animals.
Wait a second. He said that he got better because he ate cattle dewormer.
You have individuals like Joe Rogan, for example, who don't want to take an experimental vaccine but will take horse dewormer.
Ivermectin is often used to deworm livestock.
Ivermectin apparently given to deworm animals.
Joe Rogan, he came down with COVID. He says he's been taking the livestock dewormer ivermectin.
Ivermectin is a drug that is commonly used as a horse dewormer.
He may not have gotten it from the feed supply store, but it's the same compound.
When you have a horse deworming medication that's discouraged by the government, that actually causes some people in this crazed environment we're in to actually want to try it. That's the upside down world we're in with figures like Joe Rogan.
Add that to Joe Rogan then calling out Sanjay Gupta and CNN.
The rest of them are all lying about me taking horse medication. And we should talk about that.
That bothered you.
It should bother you, too. They're lying at your network about people taking human drugs versus drugs for veterinary.
Calling it a horse dewormer is not a flattering thing. I get that.
It's a lie. It's a lie on a news network, and it's a lie that's a willing... That's a lie that they're conscious of. It's not a mistake.
Yeah.
They're unfavorably framing it as veterinary medicine. Don't you think that a lie like that is dangerous on a news network when you know that they know they're lying? You know that they know that I took medicine. You think that's a problem, that your news network lies?
Well, I don't.
Dude.
What did they say?
They lied and said I was taking horse dewormer. First of all, it was prescribed to me by a doctor.
Yeah.
Along
they
with
shouldn't have said
a
it was
bunch of other medications.
If you got a human pill, because there were people that were taking the veterinary medication, and you're not, obviously. You got it from a doctor, so that it shouldn't be called that. Ivermectin can be a very effective medication for parasitic disease. And as you say, it's probably, I think 250 million people have taken it around the world.
More,
I get that.
Way more.
So
way more. Billions of people have taken it.
Can I just come back to the one I want to talk about? Two things on the ledger.
Before we get to that, does it bother you that the news network you work for out and out lied, just outright lied about me taking horse dewormer?
They shouldn't have said that.
Why did they do that?
I don't know.
You didn't ask? You didn't think that was you're the medical guy over there.
I didn't ask. I should have asked before coming on your podcast.
But they did it with such glee.
No,
yes,
Joe.
They did. I watched.
So track the CDC director saying that 98% of COVID cases now, at the time of this video, are from the Omicron variant.
The magnitude of this increase is largely related to the Omicron variant, which now represents about 98% of the COVID-19 cases in the country.
Now let's add that to Rochelle Wolensky saying that with the 98%, the Omicron variant is 90% less deadly.
When compared to Delta, infections with Omicron were associated with a 53% reduction in adjusted risk of symptomatic hospitalization, displayed in the first panel, a 74% reduction in adjusted risk of ICU admission, displayed in the middle panel, and a 91% reduction in adjusted risk of mortality, displayed on the third panel. No patients with Omicron required mechanical ventilation.
And when you add all of that up, it equals big government sucks at their job. Somebody lied, the media has an agenda, and you should do your own risk assessment for your own life and stay out of everyone else's business. I remember when people like Joy Reid were saying people were going to take up a hospital bed from someone that needs it.
Because they are collapsing our health system. They're the ones in the ERs. They're taking it up. If you have a stroke or you have a heart attack, you can't get in the ER because they're taking up all the beds. So shouldn't they have to pay more?
I remember back in December of 2020, Joey Behar saying that people that don't wear masks should sign a waiver that they don't take up an ICU bed, threatening other people's lives.
Somebody reminded me during the break, these people who refuse to wear a mask, refuse to social distance, I said this before, they need to sign some kind of a legal paper saying, if I get sick, I will not go to the ICU. I will not take up a bed and threaten other people's lives. I think that they should have done that in the first place. Just saying.
But even back at the beginning of the lockdowns, Dr. Burke said that there was no evidence of that being true.
That there are still ICU beds remaining, and there's still significant over 1,000 or 2,000 ventilators that have not been utilized yet. Please, for the reassurance of people around the world, to wake up this morning and look at people talking about creating DNR situations, do not resuscitate situations for patients. There is no situation in the United States right now that warrants that kind of discussion. You can be thinking about it in a hospital. Certainly many hospitals talk about this on a daily basis. But to say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now. And it's our job collectively to assure the American people that it's our collective job to make sure that doesn't happen.
Back then, the mainstream media would put coronavirus cases on the screen. So every time you turned on the TV screen, you would see the number just go up, 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 and up. But now that Biden is president and the blue states are getting hit hard with record number of cases, as Omicron hits, COVID-19 case counts don't mean what they used to. So they decided to change it up a little bit. But even with all the gloom and doom, like when Joe Biden said in December of 2021 that it was going to be a winter of severe illness and death.
For unvaccinated, we are looking at a winter of severe illness and death for unvaccinated.
People like Representative AOC escaped to Florida and was out having a great time without wearing a mask. Then when she got called out for being maskless, she said that Republicans were trying to date her.
Creepy weirdos. That is how Congresswoman Alexandria Ocasio-Cortez is describing Republicans who are attacking her for taking a New Year's trip to Florida with her boyfriend. She responded to one critic saying, quote, "If Republicans are mad, they can't date me. They can just say that instead of projecting their sexual frustrations onto my boyfriend's feet, you creepy weirdos."
But then she was diagnosed with COVID. Now, conservatives aren't upset that she wasn't wearing a mask. They and others were calling her out for the blatant hypocrisy. Ted Cruz called out the hypocrisy of journalists just the other day.
On the question of hypocrisy, you just asked, you people at the podium are speaking without masks. Just once, I'd like to see a reporter say to Joe Biden when he stands at the damn podium in the White House without a mask, "Mr. President, why aren't you wearing a mask?" Just once, I'd like to see you say to Jen Psaki, the White House press secretary, when she stands at the podium with no mask, "Ms. Psaki, why don't you have a mask?" The questions are only directed at one side, and I gotta say the American people see the hypocrisy.
Remember when Joe Biden said that it was Neanderthal thinking when Florida and Texas removed the mask mandates?
And the last thing we need is the Neanderthal thinking that in the meantime everything's fine, take off your mask, forget it.
I mean, the masks do look stupid.
What we've been able to do is this looks stupid. I've been able to.
Will you be my alibi?